my first question for you is around sort of understanding the scope of practice for pharmacists. Sort of what's the scope of practice for pharmacists versus a pharmacy tech versus an intern? What does that look like?
So when we think about the scope of practice, so obviously our pharmacist as a healthcare professional, they do have a doctorate. So all pharmacists now graduate with a PharmD. So they have a doctorate of pharmacy. And then when you think about what that entails, there's really a wide scope of what pharmacists can do and how they can practice, and what we like to say, practice at the top of their license or at the scope of their licensure. And so some pharmacists will go on and do residency. So I'm residency trained. There's lots of pharmacists that go on and do residencies. And so we are able to collaborate with physicians such as yourself and provide clinical services, which typically are direct patient care. So that could be done in an outpatient setting, it could be done in a clinic setting, or it could be done in a hospital setting. So that's kind of a little bit about pharmacists. And then when we think about pharmacy interns in particular, pretty much the scope of practice there is that they are trainees. And so it's kind of similar to physician training, but as an intern, they aren't actually licensed yet. Compare that to a pharmacy resident who is still technically in training, but they are a licensed pharmacist. So they've gone through, they've taken their boards, they are licensed, they can practice. And so pharmacy interns, there are specific laws depending on each state that will dictate what their scope of practice is. And so really what that extends to is under the supervision of a licensed pharmacist, they can do things like vaccinations, they can help with chronic medical conditions screenings like diabetes screenings, cholesterol, high blood pressure, those kinds of things. And then last but not least, our pharmacy technicians, which really are phenomenal resources for pharmacists. They are there really to help with, in a community pharmacy setting, as well as in a hospital setting, helping with the preparation of medications. In some instances, you can actually see pharmacy technicians help with some of the verification processes, once it's been initially reviewed by a pharmacist, and then obviously the final check would be done by a pharmacist. And then now we are actually seeing some states allow pharmacy technicians to do vaccine administration. So, so the landscape is definitely changing, but, I want people to understand that the pharmacist does have a doctorate, and in some cases is actually residency trained. And we do collaborate with physicians all the time in providing direct patient care.
That's super helpful. It makes it so much clearer. I think that some of us have this idea of we go into the community pharmacy and the person who is greeting us, we're not sure who they are or what their background is. So I think that really clarifies it a lot. And I think it's exciting to hear that states are getting a little bit more progressive in allowing pharmacists to partner in the care of patients, particularly for these chronic diseases and vaccinations. So that's super exciting. And thanks for clarifying.
Yeah, absolutely. I always say that, we're a physician's best friend, right? Because, anything that is a known diagnosis that is medication intensive, pharmacists can help with. And really, we can really take that extra time to go through all of those medications once that diagnosis has been made, and really optimize and be a companion to the care that you're already providing. How do you feel about the role of pharmacists expanding to now include independent prescribing or being involved with patient care in addition to our traditional dispensing role? And really, kind of share, what things, you think are pros and things you may think of as our cons as well, because obviously this only works if we can do this together, because it really is all about interdisciplinary care. So what are your thoughts?
That's a great question. I think that the possibilities are endless, and I think it's really exciting. I think that we're seeing a point in our nation now where we actually are recognizing that physicians who do primary care, who manage chronic disease, there's literally just not enough of us to do it alone with the way that our population is growing, aging and living longer, we need to optimize these interdisciplinary relationships as much as we can. And what we know about care in general is that if you have a diverse team helping take care of somebody, usually the patient is going to benefit more than if you just have one mind on it. So I think it's a really exciting opportunity that I'm hoping that over the next couple of years is going to continue to grow and expand. I think that you think traditionally, maybe a generation ago, physicians were very sort of wanted to keep everything close to them, and were wary of partnering with even nurse practitioners or nurses or health educators. And I think that also was when we had a time where it was sort of like the physician was God, said, this is what's happening, and the patient just took it at their word. And now we're really transitioning to a place where, with the expansion of access to medical information, with the ability to patients to move from one place to another, we're even just changing the relationship of provider and patient to be much more sort of a partnership, where we are providing as much education as possible to empower the patient to ultimately make the decision. So you think of it as a shared decision-making model, and it just really tailors nicely to adding to the team in a way that probably in a lot of these cases, especially what you're talking about with polypharmacy, with patients who are on multiple medications that may be interacting with each other, or they have some of these chronic diseases that over time are going to end up with either kidney failure or liver failure, things that are going to affect the metabolism of their medications. A pharmacist is actually probably almost better suited to be the one helping manage in those situations. So I think that when we think about expanding access to patients, empowering patients, and growing the team, it's just a really exciting opportunity.
Yeah, I love that you really emphasize that access to care. So as somebody who's a public health professional and really does things with vulnerable populations and seeing sort of the health disparities, especially now as we're seeing, COVID-19 has really shown light on a lot of the gaps and the holes that we have in our healthcare system. Anything that we can do to improve access to care, and not just care, but quality care, I think is just, it's just overall going to be better for, our communities. And so, that emphasis on chronic disease prevention and health promotion and, not competing, but collaborating, I think is really going to go farther, because right now we're having to do more with less, because of the fact that we do have shortages in physicians and some of our other healthcare professionals.
I think you're right. And I think you just mentioned two things that I want to really sort of circle back on. We have a really big disparity in access in our country. And so I think that people are aware of that and they put a lot of effort into improving access, but sometimes they don't think about quality. And we don't want our patients to just have access to any care. We want them to have access to high quality care. And that's a really big difference. And I think that this idea of collaborating with our team, that improves quality. And so I think that it really goes hand in hand nicely, and is going to be the wave of the future. This actually dovetails nicely into my next question for you. When we're thinking about working in interdisciplinary teams and all of the different touch points that a patient might have with the healthcare community, sometimes what's happening is that since we don't really have an integrated system of communication, oftentimes things are either getting duplicated. Like, for example, with childhood vaccines, you may be giving the vaccine as the pharmacist, but then they also got it in school and they got it at the pediatricians, but none of those three things are talking to each other. And so I'm curious about what can we as providers do to help provide context and patient information, just to make sure that that care is provided smoothly, and are there places that we could be improving communication, or ideas that you have about that?
Great question. I think vaccinations is a perfect example of how, cross collaboration through the ability to access a centralized database really works. So a lot of states are investing in registries that can be accessed by all healthcare professionals. So in my state in particular, I live in Nevada, we have a state registry that in 2008, it was actually a requirement from the legislature that all vaccine providers put in that information and upload that data to the state registry within 30 days of administration of any vaccination, either childhood or adult vaccination. And I think it's really helped with that communications piece, because everyone's seeing the same data, everyone knows that the information is accurate. And, now that we're moving more into the digital healthcare space, now that we're seeing more people accepting things like telehealth and telemedicine, really having those centralized databases and the accessibility of integration with electronic medical records is going to help everyone that's part of the team. Because if we don't all have the same information, we're not going to be able to make sound decisions for our patients and really what's their best, what's at their best interest. So I completely agree with you. So we can take a lot of, tools and tips and best practices from the realm of immunizations, and hopefully moving forward as we see more integration into this telehealth space, we will see the ability to have more centralized data collection so that everyone that's part of the healthcare team can have access and therefore make better decisions for our patients. So it's coming. I know it's coming.
It brings to mind two things for me. I think you're right. I also have some experience with the vaccine registries within Alameda County here in California. And it's so wonderful to be able to access something, particularly for our newcomers or patients who may not be fully health literate or literate in English, to be able to print something out and tell them, you have X, Y, and Z, you got this here, you got that there. The other experience that I've had that I think has been really wonderful, and I know that people were hesitant about it at first, are some of the prescription drug monitoring programs for some of the controlled substances, like the opiates and benzodiazepines and stuff, to know, oh my goodness, this patient just got 10 pills of Norco here and 30 there and 40 there, and do we really want to prescribe it again? I think that that's really empowered me to feel safe in my prescribing practices, and I would love to see that expanded to other things. Just, sometimes patients will come in and they'll say, yeah, I'm on, X medicine, and then they give you a dose that is not a real dose, but they don't know, and you want to be able to help them in the moment. And so I think that with time, these registries are going to be great. And I think part of what the beauty of the pandemic has done with making people aware of telehealth in general is giving people a little bit more trust in this, that we are not, holding onto your data for some malicious purpose, but it's actually really to empower you to be your healthiest self. So hopefully that will continue in the future.
Absolutely. So I have another question for you, Kristen. And, maybe more so this year than ever, provider burnout has been a major issue. So how do you think we can help each other in this area? Because obviously, those who are working in the front line, those who are in the hospital setting, this has just been a really, tumultuous year for everyone. But in particular, I think this concept of provider burnout is something that's getting a lot more attention. So what are your thoughts?
I think you already hit the nail on the head on some of it, which is just that we need bigger teams. And we need teams where there's trust and mutual respect. And I think that that is something that has to be built on both sides. I can say that I've had, as a physician in the telemedicine space at Hey Doctor, I've had some really amazing interactions lately where pharmacists have called and said, hey, you just prescribed this patient 60 pills of Cialis, and it turns out that another doctor over here gave him that 10 days ago. And, do you really want to do that? And so the people that go out of their way to communicate, to make sure that things are being done safely for patients, or they'll say things like, the patient is on X medicine and it seems to have an interaction. And I'll say, oh my goodness, the patient didn't tell me they were on X medicine. And then I can circle back with the patient. So I think this idea of really empowering people to be a bigger team, and then reaching out with goodwill in the way of saying, I don't know if you knew this, as opposed to, why did you prescribe, and that's just a communication style that I'm seeing more and more of the positive of that, and how that can really help with burnout. Because I think burnout comes from a couple different things. One, it comes from feeling like we just don't have enough capacity to meet the volume. Another is it comes from sort of feeling like we're doing things that we weren't trained as medical providers to do, that somebody else could be doing. So speaking to your point earlier about helping making sure that people are really working at the highest of whatever their degree is. And so I think, sort of respectful communication, collaboration, and just like even sometimes just offering up. So this comes up a lot within the pandemic. The other thing that we've had a lot of access around is access to reproductive health care. And so we see a lot of women who normally would probably be going in for some sort of a long-acting reversible contraceptive, like an implant or an IUD, who just can't get in. And so they're wanting to use depot. And now we have these two different depots that are available. We have the subcutaneous and the intramuscular. In the community, there's coming around a lot of acceptance around patients self-injecting sub-Q, but not IM. But there's a huge cost differential there. And there are some states where pharmacists are actually allowed to do intramuscular injections. And so they'll reach out and they'll say, you prescribed her sub-Q, but the IM is much less expensive, and I'm actually allowed in my state to do the injection. Do you want to switch it? And I think little things like that go so far in creating both goodwill, doing what's best for the patient, and reducing our feeling of, we want to do everything that we can and we just don't have the capacity. So
mutual respect and really, that collaboration versus competition aspect, right? Like no one's trying to take anyone's job. Like we really just honestly want to help because we want to do what's best for the patient.
That actually dovetails nicely into my last question for you, which is sort of along this same idea. Are there other ways that we could be working together to provide better patient care? Are there other collaboration opportunities for the future that you think about?
Obviously if it was a perfect world and I could, impact, all these different clinic settings, I would say, pretty much every physician's office should have a pharmacist in their office, right? Like if I could do that, like that would be amazing. Obviously I don't have that option, but kind of going back to your comment about reproductive health, I think, if we could, really free up the physician's time to doing things like procedures or deliveries or, things like that, where we could, take on, the contraceptive and the reproductive health side, or even just talking about fertility awareness and fertility needs, and, not always thinking about vaccinations and contraception and, doing things, related to prevention, but really thinking about like the holistic approach of like, how can we really make, women's health be, like the whole picture, and having people, understand that, these are the things that the pharmacist can actively do, take that extra time, be able to counsel, talk about what the potential side effects are, really adjust, because, each one of those contraceptives, has a little bit different hormone in it. And a lot of times the physician doesn't know, what all those intricacies are, because, the last person was like the rep who came in and said, this was the next latest and greatest, but, we can really go in, do that extra deep dive, and really help out and really free you up as the physician to be able to provide those more advanced, higher level services that ultimately could be potentially revenue generating as well. So I almost think of this as like, those partnerships that really could maximize not only your time, but your money. Because if you are freed up to do more of these higher level procedural things, you can bill at a higher cost. Versus me, I can bill for those incident to physician services and those counseling services, and I can generate revenue for your practice. So I would say, number one, where can pharmacists really help? And that's really in provider offices, and really helping us to kind of get out of that community pharmacy setting and less of a focus on a product, which is a pill or a prescription, and really thinking about how we can use our cognitive services to really help maximize the care that you're able to provide to your patient.
That's super exciting. I'm really excited that we had the opportunity to talk about all these things. And I'm glad to hear that there's sort of interest and goodwill on both sides to collaborate more and ultimately to be doing what's best for the patients and the population. And it's an exciting time to be in healthcare, I guess.
Yeah, I completely agree with you. And I just, again, want to reiterate how how much it's meant to me to just really dialogue with you and really understand sort of like those intricacies of like, what the physician, world is thinking, and again, really how we can collaborate versus thinking of this as competition. And I think if more physicians and pharmacists work together like this, we would be able to provide better healthcare.
Yeah, no, this was really lovely for me. I feel like just talking to you I've gotten so much perspective and learning, and I'm excited for the future too.
Thanks to GoodRx for bringing us together. And ultimately, thank you so much for your time. And I really look forward to hopefully collaborating with you again in the future.
Likewise, thank you.